We're very pleased to have with us Soma Stout. And this panel is going to be about approaches and perspectives on community engagement and partnerships to improve community health. This next panel is going to be moderated by Soma Stout, the executive lead for 100 Million Healthier Lives, an activity convened by the Institute for Healthcare Improvement. Soma is also a member of the Workshop Planning Committee. And Soma, I'm going to let you introduce your panel and go for it.
Perfect. Good morning, everyone. You know, as I was thinking about the powerful remarks this morning and reflecting on sort of what went into thinking about this panel, you know, it struck me that we could just as easily call this the power of shifting power and collaboration to improve the health and well-being of communities and equity. And, you know, I think many of the stories that I think you'll learn about in this panel, you'll hear about, I hope will give us a chance to really dig into what does it look like to actually create those conditions in communities? What are we all learning about that? Our panel will be a very interactive one, and we'll ask you to get involved in actually creating and thinking about some of these things with us. But to help us to do that, we'll have some remarkable communities, and these are two of the 24 that have been involved in the SCALE initiative of 100 Million Healthier Lives, who have been discovering together on their journey to a culture of health, how they create a community of solutions. Before I jump in, I thought I'd share a little bit about what 100 Million Healthier Lives is about and how these ideas of shifting the balance of power and equity are interwoven in that. So we call 100 Million Healthier Lives an unprecedented collaboration of change agents who are pursuing an unprecedented result of 100 million people living healthier lives by 2020. And the way we're going to do that isn't to go out and change them, it's actually by changing us, by transforming the way we think and act as people who are in communities and in systems of power to transform the way we think and act to create health, well-being, and equity. So what we say is that in order to get there, we need unprecedented collaboration, which we're going to talk a lot about. What does that look like at the community level today? Innovative improvement, which is both the courage to ask questions about what's happening and the courage to fail forward, to learn, to know that we don't know, but that together we might be able to get to some solutions. And systems transformation, to have the courage to look at those systems that Tony spoke about so powerfully this morning, along with the rest of his co-panelists, and say that if these are the systems that are creating inequity, how do we intentionally break down those systems? And to do that, not only from our positions of using data and science to do that, but actually to understand what the stories of people with lived experience, what their insights about how the system works and is operationalized in communities, and therefore their solutions to how to interrupt those systems can come together with the gifts that people who have other positions, who have formal power in our communities. What it looks like when those two groups aren't separate groups, but actually see that each other is part of the same team. And when we recognize that each other's piece of the puzzle is needed to create the solutions that are needed in our communities. We've said that equity is the price of admission in 100 million. And we've redefined what that means to be about who isn't thriving in an intersectional way, and to ask what that looks like for it to change. And to do that, we've realized that if we're going to transform the way we think, that we need to do several things. We need to, in all of us, develop our capacity to lead from within, which means that we need to learn how to be self-reflective about who we are, where we are, and how we're leading, to be able to develop the skills to get to understand our story and understand the story of the people that are before us and the places that are before us, and to understand what it looks like to come together, to lead together, to understand and appreciate where the differences that we have make us stronger and where they are mere relics of the past that need to be left behind. And to have the courage to lead for outcomes, to actually say, we're going to figure out what it takes to actually create an improvement. And we know that we don't know, but that's okay. We're going to put something, a stake in the ground about the possibility that real improvement is possible. And then we're going to figure out whatever it takes to get there. And that together, applying those skills to equity can hopefully offer us something. as we've been doing this, we've been learning so much with the 24 scale communities that have been our sort of first flagship communities on that journey with the support of Robert Wood Johnson Foundation. And the Robert Wood Johnson Foundation actually, in creating this program itself, chose to shift its balance of power. Rather than having a community initiative that was simply based on here's an outcome that will be achieved, it was instead, they offered us the ability to co-design with them what it would take to help accelerate communities toward a culture of health. And as we've been figuring out what it looks like to create these communities of solution, we've been discovering the elements of that people who relate to each other in these communities in a different way, that the way leaders come together to create abundance is different, and that the way that community takes on the change process itself to grow the equity, which also translates to ownership if you are in an economic environment, to increasingly grow the ownership of everybody in the community, and in particular to grow the ownership of those who are most affected by the structural racism and inequities of our system. And so with that introduction, it is my great privilege to introduce two teams that have been working hard at this, one in San Francisco and one in Algoma, Wisconsin. First will be the Tenderloin Health Improvement Partnership, and we have Will Douglas, who's a manager of community impact, and Jennifer Laxon, the manager of community benefit and emergency management here. And then after that will be from Algoma, Teal Van Lanen, who teaches, is a community activator and is part of the Algoma School District, and Pete Knox, who's the executive vice president of Bellin Health and the chief learning and innovation officer for Live Algoma. I'm just going to turn it over to you.